Hello everyone. Welcome to the world of anti-glaucoma surgeries. Anti-glaucoma surgeries are sight-saving surgeries. Trabeculotomy has been the gold standard of anti-glaucoma surgeries for a very long time. Angle-based surgeries, which have picked up recently in India, have many types, of which Gonioscopy-Assisted Transluminal Trabeculotomy has been a worthy challenger to the hegemony of TRAB, at least in the short run. In today's presentation, we will be comparing the surgical technique of trabeculectomy with mitomycin C versus gonioscopy-assisted transluminal trabeculotomy, hereby referred to as GATT. In the first video, we will be discussing trabeculectomy with mitomycin C. This surgery is an ab externo surgery. After adequate exposure of the eye, a fornix-based conjunctival flap is made. After achieving hemostasis, 0.04% mitomycin C soaked merosyl sponges are kept in the subconjunctival space for a duration of 2 minutes. After a thorough wash, a triangular flap is created and a uniplanar dissection is ensured up to the surgical limbus. After creating a deep scleral window, an ostium is made. A peripheral iridectomy larger than the size of the ostium is created. Iris is reposed back and the anterior chamber is formed with balanced salt saline. Apical 10-0 releasable suture is taken. The conjunctiva is sutured with 8-0 vicryl suture. The GATT surgery starts with the creation of a bulbous tip of a 5-0 proline suture. This suture is inserted through the side port. For better visualization of the angle, head tilt and microscope tilt is given. Trabecular meshwork is visualized with a TVG gonio lens placed over the cornea over a blob of viscoelastic. After visualization of the angle, a nick is made with the MVR blade. Cohesive viscoelastic is injected through the Schlemm's canal through the neck. With the help of a fine microforceps, proline suture is passed through the Schlemm's canal with gentle strokes till the leading bulbous tip is visualized after traversing the 360 degrees of the Schlemm's canal. About 20 to 25 strokes are needed for the complete passage of the Schlemm's canal. The leading and trailing ends of the proline suture are gently pulled, ripping open the Schlemm's canal. After removal of the suture, the anterior chamber is washed with balanced salt saline and the wound is hydrated. Here we can see a comparison between the two surgeries. The humble trab, which is a ab externo approach, takes slightly more time and has a lesser learning curve. It is useful in all types of glaucoma and there are hardly any contraindications. The recovery time is 1 to 3 weeks. Versus a GATT, which is a faster surgery with an ab interno approach, needs a longer learning curve. A head tilt is essential and is useful only in mild to moderate glaucomas which are of the open angle type. If we do not visualize the trabecular meshwork, we would not be able to do this surgery. It has a very fast recovery time of less than 1 week. Another advantage of the GATT is the need for very low dose steroids, which would be very useful for patients who are steroid responders. In a trab, we have to face all kinds of complication, including blebitis, which is the most dangerous complication. Here we can see a patient whose right eye underwent a trabeculectomy and the left eye underwent a GATT surgery. In the right eye, the patient would have to live with an ostium all his life, versus the left eye, which we may not be able to tell which surgery was done. Here, only an OCT can help us by demonstrating the trabecular shelf sign. Which one would you choose for your patient? An ode is a lyric or a poem that often celebrates a person, place, or an idea. Thanks to AI, we could create an ode to glaucoma's fight. In the depths where vision fades, a silent thief in darkness waits. But hope is born in skilled hands' art, through GATT and trab, a healing start. GATT's gentle touch, a guiding light, to clear the path, restore the sight. A passage opened, pressure eased, a future bright and the patient pleased. Trab, the stalwart guardian, true, a careful cut, precision's due. Through scleral shield, it makes its way to save the sight, to win the day. In eyes where shadows once held sway, a new dawn breaks, the light will stay. For GATT and trab, the surgeon's pride, bring back the world with vision wide. So here's to those who skillfully mend, who fight for sight, who never bend. With every stitch and careful guide, they give us back the world outside. Thank you for your patient listening.